Think your prescription is harmless? Some of the most common drugs may actually be rewriting your brain's future. Welcome back to Skin Fact or Skin Fiction, where we expose which meds are medicine and which might be memory traps. Picture your brain as the Wi-Fi hub for your life. Now imagine plugging in 4 silent leeches, namely statins, anticholinergics, proton pump inhibitors, and benzodiazepines that slowly drain its power. If you've been on TikTok lately, you would think long-term use of all these meds has been tied to increased Alzheimer's risk. I decided to take a closer look at these claims and review the medical literature so you don't have to. First off, statins. Statins are a class of drugs that lower cholesterol levels in the blood by inhibiting HMG-CoA reductase, the key enzyme the liver uses to make cholesterol. By blocking this pathway, statins reduce LDL, or bad cholesterol, and triglycerides, while modestly increasing HDL, or good cholesterol. They're primarily prescribed to prevent and treat atherosclerotic cardiovascular disease like heart attacks and strokes, and reduce cholesterol in people with familial hyperlipidemia or other lipid disorders. Examples of such drugs are Lipitor, Crestor, and Zocor. But do these drugs actually increase your risk of Alzheimer's disease? Multiple meta-analyses, I'm talking 36 studies with up to 9 million people, show no consistent signal that statins increase dementia risk. In fact, hydrophilic statins like pravastatin or Pravachol may be associated with reduced dementia incidence, although these studies are ongoing. So plot twist here, but I put it on this list because TikTokers are claiming it does without any explanation. We've got meta-analyses of millions of people that put these drugs in a neutral or even slightly protective category. So in my opinion, they are not the villain TikTok has made them out to be. But if TikTokers have you all freaked out about it, then there are alternatives you can talk to your doctor about, like cholestyramine inhibitors or niacin. Of course, diet modification and exercise also make a big difference. I've had patients reduce their LDL by 30 to 40% just by diet and exercise alone. Next on the list are anticholinergics. Anticholinergics are drugs that block the action of acetylcholine, a neurotransmitter in the parasympathetic nervous system. Acetylcholine normally stimulates rest and digest activities like salivation, digestion, bladder contraction, and pupil constriction. By blocking it, anticholinergics reduce secretions, relax smooth muscles, and alter nerve signaling, effects that can be helpful in certain conditions, but also come with side effects like dry mouth, constipation, blurred vision, urinary retention, and memory problems. These drugs are often used to treat overactive bladder or urinary incontinence, muscle spasms in the gut, COPD, or asthma symptoms, and they help control motion sickness or nausea. The most widely used and known are Benadryl and Dramamine. Most of you have also heard of scopolamine patches placed behind the ear. So why do these drugs boost the risk of Alzheimer's? Well, they block acetylcholine, the neurotransmitter that helps you remember where you parked your car. 7 meta-analyses with populations up to 1.6 million people showed up to a 46% higher dementia risk and a clear dose-duration relationship, which means the more exposure over time, the higher the risk of dementia. In fact, one large cohort study found that people taking 4 or more different anticholinergic medications at the same time on a regular basis had about a 2.6 times the baseline risk of developing dementia compared to those taking none. This wasn't about popping 4 pills in a day. It reflected the long-term cumulative burden of these drugs over months or years. So what are some alternatives? Use non-anticholinergic options. For example, for bladder control, try mirabegron. For allergies, choose modern second-generation antihistamines like Zyrtec or Claritin. These shut down histamine release without the brain fog and cotton mouth that come with Benadryl. Next up is your heartburn medicine causing brain burn. Number 3 on the list are proton pump inhibitors, or PPIs. These drugs basically tell your stomach's acid factory to clock out early. They block hydrogen potassium ATPase enzyme, aka the proton pump, located in the parietal cells of your stomach lining. This pump is the final step in stomach acid production. PPIs bind irreversibly to that pump, shutting it down. Because the binding is irreversible, one dose can suppress acid for 24 to 48 hours until new proton pumps are made. This results in less stomach acid, less reflux, and less heartburn, faster healing of stomach ulcers, and protection against acid-related damage. PPIs are effective, but they're not meant to be a forever pill for most people. The problem encountered with these drugs come with chronic use. You can develop a rebound acid hypersecretion when you stop them suddenly. Your stomach can overcompensate by producing even more acid. Patients often think, my reflux is worse than ever. I must need this pill for life. But it's just this rebound effect. You can develop nutrient deficiencies with long-term use of these drugs. Vitamin B12 needs stomach acid to detach it from food proteins. A low acidic environment will lead eventually to poor absorption of B12, and chronic B12 deficiency can mimic dementia or neuropathy. Long-term use of PPIs can also impair absorption of magnesium and calcium, raising the risk of muscle cramps, arrhythmias, and osteoporosis-related fractures. Also, when you have chronically low stomach acid, you can be more prone to infections because it makes it easier for pathogens to survive. So, are PPIs an Alzheimer's risk? First, chronic low B12 is a well-established risk factor for cognitive decline. Multiple studies show that patients on long-term PPIs have higher rates of B12 deficiency, which could accelerate memory loss. Secondly, PPIs can affect amyloid metabolism. Amyloid beta is the sticky protein found in Alzheimer's plaques, and mouse models show that it is elevated in mice on long-term PPIs. Several large observational studies found a higher incidence of dementia in elderly patients on chronic PPIs compared to those not taking them. The risk increase was around 40 to 50% in some cohorts. Keep in mind, these are associations, not proof. People on PPIs are often older, sicker, and taking multiple medications, all of which are confounding factors. But the biological plausibility makes this hard to ignore. My recommendation is to use the lowest dose for the shortest time, or switch to an H2 blocker like ranitidine, famotidine, Pepcid, or Zantac. Fixing lifestyle triggers, diet, and timing of meals can also help. In other words, don't eat dinner at 8 p.m. and go to sleep at 9. You can also eliminate things that may be contributing to increases in acid. Something I did is switch from regular to low acid coffee. Lastly, let's talk about benzodiazepines. These drugs, like Xanax, Valium, Ativan, they work by pressing the brain's chill button. They don't create calm on their own, but they make your natural calming chemical, GABA, G-A-B-A, way more effective. That's why they can knock down a panic attack in minutes. But here's the catch. Long term, they don't just calm your brain, they kind of dull it. Memory, focus, and learning take a hit. And large studies show that people who stay on benzos for months or years have a much higher risk of developing Alzheimer's disease. Why? Well, there are two main reasons. One, they block the brain's ability to rewire and store memories. And two, they can lead to deficiencies and changes in brain chemistry that promote Alzheimer's changes. Even at therapeutic doses, long-term benzos cause measurable issues with attention, memory, and executive function. That chronic cognitive drag is thought to accelerate dementia risk. 3 meta-analyses involving up to 2.3 million individuals found a 33% to 78% higher dementia risk with long-term benzodiazepine use. That is not insignificant, people. Another classic case control study done in France and Canada showed 3 to 6 months of use resulted in a 32% increased Alzheimer's risk, whereas greater than 6 months use resulted in an 84% higher risk. Think of benzos like fast food. A Big Mac is great in a pinch, but if you live on them, it'll catch up with you. If you're on one daily, it's worth talking to your doctor about safer options. So benzos are pure trouble. Your anxiety meds shouldn't make you forget you have anxiety. So what's the smarter game plan? If it's insomnia, look at fixing sleep habits, using melatonin or safer meds like trazodone or low-dose doxepin. If it's anxiety, we've got SSRIs, SNRIs, or buspirone. These are not as fast-acting and are slow to kick in, but are protective for your brain in the long run. So folks, some meds are like bad exes. They seem helpful at first, but quietly mess with your head long term. In this case, they could literally mess with your head by raising your Alzheimer's risk. 3 of these meds, anticholinergics, PPIs, maybe, and benzodiazepines, are linked with a tangible Alzheimer's risk signal when used long term. Statins, by contrast, are neutral or possibly protective. But don't panic, now you know. It's about being smart about what stays in your medicine cabinet moving forward. Don't just ghost your meds. Talk with your doctor to de-prescribe safely, swap to safer options, and lean into lifestyle changes that protect your brain. Your future self will thank you for choosing clarity over complacency. That's it for today's episode. Please comment, like, and subscribe, and I look forward to speaking to you all next time.